The President of the General Assembly, His Excellency Mr. Volkan Bokeh, Excellencies, ladies and gentlemen, I congratulate you, Mr. President, for convening this meeting, which affords us an opportunity to take stock of the progress made in the global fight against the HIV and AIDS pandemic. In 2016, we committed to reduce new HIV infections and AIDS-related deaths, as well as to eliminate HIV stigma and discrimination. The Secretary General's report on addressing inequalities and getting back on track to end AIDS by 2030 has exposed the glaring inequalities in our world today. The situation has been worsened by the ongoing impact of the COVID-19 pandemic. Mr. President, the HIV and AIDS pandemic has negatively impacted global economies, livelihoods of communities and individual households alike. Together with COVID-19, the two challenges give us reason to strengthen multilateralism, solidarity, and cooperation. In our march towards ending HIV and AIDS by 2030, bold, ambitious, and achievable global targets must be implemented with the requisite funding. We commend the joint United Nations program on HIV and AIDS for adopting the Global AIDS Strategy, which provides guidance to countries towards ending AIDS by 2030. To this end, Zimbabwe has finalized its own national strategic plan for 2021 to 2025, which focuses on investment in areas such as health and social protection, among others, whilst protecting the gains achieved so far. I'm pleased to highlight that Zimbabwe achieved the 2020 targets of ensuring that 90% of people living with HIV know their status. 90% of those who know their status are on antiretroviral therapy, and 90% of those on antiretroviral therapy are virally suppressed. In addition, my country recorded a 44% decline in new infections between 2010 and 2019. My government remains grateful to development partners, the Global Fund, and other stakeholders who continue to support our programs. We call for the redoubling of efforts in the face of the COVID-19 pandemic and urge partners to continue providing sufficient funding, specifically to low and middle income countries. In conclusion, it is our hope that the ambitious and the bold new goals espoused by the political declaration we are adopting will guide us and serve as a reference as we continue the fight against AIDS. I therefore call upon the international community to recommit to multilateralism, being mindful of the reality laid bare by the COVID-19 pandemic. I thank you.